Do you think cataract surgery is just the removal of lens? It is nowadays become more about choosing the right lens for your eyes. Hi, I'm Dr. Neelima Shah. I'm a senior consultant ophthalmologist at Dr. Agarwals Eye Hospital, Padmanabhanagar, Bangalore. So what is cataract? Cataract is clouding or opacification of the natural lens inside the eye. This happens because of changes in the lens protein. It is related to aging commonly, but sometimes even the newborns or young kids or younger adults can develop cataract. When cataract develops, the vision reduces. Some patients also face some other symptoms like difficulty in night vision, glare, halos, or double vision. So previously, cataract surgery used to be done only after ripening of cataract or once the cataract used to become harder. This is because we used to put a larger cut and then remove the cataract. Now we use very small incision and emulsify the cataract either with ultrasonic energy or with the use of laser. That's why whenever your vision gets affected, that is the right stage to get the cataract surgery done. Cataract surgery nowadays is more than just the treatment of cloudy lens. It is basically a lifestyle enhancement. So if you have cataract or if your family member has cataract, don't worry, don't feel anxious. Book an appointment at Dr. Agarwals Eye Hospital and discover the best options.